We are your station for health. This morning we're discussing long COVID in kids. What is it and how common is it? We're speaking live with Dr. Anthony Flores with UT Health. Good morning to you and thank you for joining us.
Good morning, Melissa. Thanks for having me.
Well, before it seems like we just weren't that concerned about kiddos and COVID because it seemed like just 1% of them were really suffering from severe symptoms. Now it has really jumped up. So what are your concerns about long COVID? Do you think that our kids could perhaps suffer for months at a time like so many adults have?
Yeah, that's a great question. And so I'll start by saying, that we've, in the infectious disease community and the pediatrics community, we've always been concerned about COVID in kids since the beginning, but what we're seeing now is a little bit different in terms of the numbers of kids that we're seeing with more severe disease compared to previous surges. And one of the things that does concern us is the frequency with which we'll see long COVID. To be honest, there's a lot that we don't know about it right now. But there's a lot of ongoing studies to look just at it. And so with more kids becoming sick with COVID, we certainly worry about this a lot.
All right, let's talk about what those symptoms would look like. What are you seeing in children who have this long COVID?
Yeah, so the most common things that we see are fatigue, headache, sometimes loss of taste and smell, especially in the older kids that we also see in adults. Those are the most common things that we'll see. And then there's a variety of other things. And these can persist up to just a couple of weeks after the diagnosis or sometimes up to a few months.
So we're talking really messing with their quality of life when they're already going through a hard time trying to figure out school and everything else during the pandemic. Let's talk about treatment options. Are there quite a few available to help these kids get back on their feet faster and perhaps to recover from long COVID even better than if they didn't have that?
Yeah, no, unfortunately, there's no specific treatment that we would do for long COVID. The best thing that we can do is to try to prevent disease in the first place. And this is where we've been harping ever since we've had a vaccine available, and especially for our teenagers now, and hopefully very soon for our younger kids. Vaccination is the absolute best thing that we can do as adults to protect our children. And then once available for all of our children to vaccinate them. Apart from that, it's trying to do those other things to prevent disease, wearing masks, social distancing, hand hygiene, all those other things that we know are effective in preventing infection.
In adults, we have definitely seen patients who perhaps are obese or perhaps they don't have their diabetes under control. Those seem to be some of the more severe symptoms. We know that more kids than ever have type 2 diabetes right now. Are you seeing that be the case with children now who are in the hospital, that they might have some of these different problems?
We certainly see kids with comorbidities such as diabetes and obesity that are just like adults at higher risk for severe disease due to COVID than others. But we're seeing, plenty of healthy kids coming in as well. And I think this is what concerns us more, is that we're seeing kids with more respiratory symptoms that we didn't see in the past that otherwise don't fit that exact demographic that we were expecting.
And I know that one thing I like to do as a medical reporter is not just give any type of grim news, but also give our viewers hope and give them some ideas of how to help perhaps treat their children. One thing that we've also seen, and I've talked to a lot of doctors who say their severe patients have very low vitamin B, very low vitamin D levels. Is this a time that we might consider ramping up those particular vitamins, even zinc, in our children to try to help boost that immune system?
Well, first, we should all be trying to live as healthy as possible, and a well-balanced diet, vitamins, things like that are important for children anyway. There's no data to say that using vitamins or zinc or other supplements is going to prevent COVID or other respiratory viral infections. So taking excess amounts of those can potentially be dangerous, and I think should be done very, very, very carefully. So it's kind of yes, we should be healthy, but taking them just to prevent COVID is probably not going to work.
And if you consider supplements, it sounds like always a good idea to talk to your doctor just to make sure you're doing that right dosage and you don't give too much. All right, Dr. Flores, thank you for taking time from UT Health today to talk more about this, just so that everybody understands what's happening with our children.
Thanks, Melissa.